We are in the middle of a medical cultural myth right now that the MD is God. Please show me the research that says that high cholesterol is bad for me, because there's tons of research that show that high cholesterol is good for me. Everybody thinks, the medical doctors, you know what doesn't stink. Everybody thinks that the MD holds the secret decoder ring to all things medical. Ladies and gentlemen, you've been played by 100 years of pharmaceutical propaganda.
Are you sick and tired of being sick and tired? Have you finally come to the understanding that your medical doctor does not know what's best for you? Have you ever wondered why conventional medical doctors are not concerned with curing anything? If you have answered yes to any of these questions, then you have come to exactly the right place at exactly the right time. This is where the enlightened come for straightforward answers to their health concerns. This is the undiscovered country of science-based, clinically verified, holistic medicine. It doesn't get any better than this. It's time to attempt a cure with Dr. Glidden.
Welcome aboard, everybody. Dr. Peter Glidden, your steadfast advocate for health. Welcome aboard, everybody. September 7th, 2017. Dr. Peter Glidden, your steadfast advocate for health. Thanks for tuning in and turning on. This is the second edition of Hire Your ND Now. Every Thursday, and God willing, and the creek don't rise at 11 a.m., we will be producing new episodes for your edification. To learn more about me, visit my Facebook page, glidden.healthcare, or more importantly, my website, right there, glidden.healthcare. See a pattern? Knowledge is power. We are suffering needlessly all around the world because of lack of knowledge, lack of education inside of monopolization of the medical marketplace. We haven't had a free medical market in the United States since the early 1920s. Most people who are alive now were not alive then, so nobody knows what it was like before the medical marketplace was monopolized by the medical doctors. And look, my position is we're not anti-MD here. We're not. We are not anti-MD here. We are pro a free medical market. And, you know, like the fella said, absolute power corrupts absolutely. Because of the monopolization of the medical marketplace by the MDs and the pharmaceutical industry for the last 100 years, the information that most people have had access to is only a very small piece of the pie of what is really happening in medicine around the world. You have been socialized to believe that medicine equals what the MDs do, and everybody else is a back-of-the-bus quack with substandard dangerous training. You have been socialized to believe that your medical doctor, bless their hearts, has the secret decoder ring to all things medical, and if they don't know it, then nobody does. And it's nonsense. There's room in the world for everybody. We need a free medical market. And because we don't have a free medical market, we're suffering from propaganda, quite frankly, and misdirected information. And we simply need perspective. And so that's why I'm here. That's my job, to help you understand what's really going on. And more importantly, to give you knowledge that can give you power to make the appropriate choice for your health. Sometimes you need the medical doctor. Sometimes they are exactly the wrong person to go to. But because we don't have a free medical market, the only thing that you have access to is conventional medical treatment. And so you need to educate yourself before you get sick so that you can make the proper choices. All right. Now, a couple of years ago, a gentleman at the Health Freedom Expo in Schaumburg, Illinois, I was lecturing at the Health Freedom Expo, and the owner of Puritan's Pride Vitamins, right? Remember Puritan's Pride Vitamins? They were, you know, like a very, very old vitamin company. They were around when, you know, my parents were coming up, right? Puritan's Pride, everybody knew Puritan's Pride. Anyway, the owner of Puritan's Pride retired, I think, and wanted to give back to the community because, you know, he was good. So he hired a couple of videographers to go all around the country filming different holistically oriented, licensed, regulated physicians about their experience with different aspects of health, right? To give the other side to the story, which people are so egregiously lacking in. So he filmed me at the Health Freedom Expo, and they posted their video on their website, and it didn't get very much traction. And then about a year ago, the person who calls themselves Anonymous on Facebook got wind of this video, posted it, and it went viral. As of today, September 9th, 2017, it has over 50 million views. Now, that's a lot of views. And basically in this video, in this interview, in this recording, I was just telling the truth about an Australian study that had been done and published. They did an overview, a meta-analysis of people in Australia who had developed different types of cancer and were treated with chemotherapy. And the intention of the study was to see, well, was the chemotherapy effective? And it was not. It was not effective in helping to diminish cancer. And of course, the naysayers, Snopes, got a hold of this, and they said that the information that the researchers did was biased, and it wasn't very good, and it was a small data pool. And quite frankly, this is exactly what I'm talking about, because we don't need propaganda. We just need the facts, ma'am. Simply the facts. So my intention here this morning is to, and by the way, this is a live event. I have not pre-recorded and edited this. This is a live event. So my intention here is to help you to understand the facts regarding cancer. Because like the fella said, you're welcome to your own opinion, but you most certainly are not welcome to your own set of facts. Let's jump in. So these are statistics drawn from the Cancer Treatment Centers of America and the Center for Disease Control in the United States. The CTCA here results are in green, and the SEER, that's the national database for cancer in the United States. The results are compared, and Cancer Treatment Centers of America, by the way, who employs naturopathic doctors to manage the side effects of chemotherapy, radiation, and surgery for their cancer patients. They don't use naturopathic therapeutics as primary treatments for cancer. They use them as adjunctive, secondary or tertiary treatments to clean up the mess that the primary MD treatments make, right? But nonetheless, the Cancer Treatment Centers of America has been very good to the naturopathic community. But I'm not here to give positive strokes. I'm here to just tell the truth, okay? So here are the facts that are published. Now, you can have your own opinion about what this means, but let me give you mine. So, colon cancer survival rate. This is over 5 years. At the bottom is years. And the up and down axis is the survival rate. So the bigger the bar, the more people survive. The smaller the bar, the less people survive. Okay? So if you have been diagnosed with colon cancer after 5 years at the Cancer Treatment Centers of America, 90% of the patients will have died. 10% will have lived. 88% will have survived with treatments outside of Cancer Treatment Centers of America. This after 5 years. Now, we're going to talk about the 5-year survivorship paradigm in just a minute. But this is, well, let's talk about it now. So the treatments for cancer all around the world in conventional MD-directed allopathic reductionistic pharmaceutical centrist medicine. Say that 10 times fast. MD-directed allopathic reductionistic pharmaceutical centrist medicine. Monopolistic Machiavellian medicine. Around the world, they have stopped even considering the word cure. The only time that they use the word cure is for propaganda campaigns in order to get more money. Oh, we're going to fight for the cure. We're going to find the cure for cancer. Well, you've done a horrible job at it so far. Why would I keep throwing money into that well? Because it's a monopoly is the answer. But my point here is the results of conventional cancer treatment are so poor that they stopped even considering the word cure. Now, according to the powers that be in conventional medicine, if you develop cancer and you live for 5 years or longer, then it was a successful treatment, even if then you die from cancer. So they don't talk about cancer cures. They don't talk about beating cancer and surviving. Well, they talk about surviving cancer, but they don't talk about curing cancer because it can't be done. Well, a very small percentage of cancers can be cured. My point here is that when you are told about cancer treatments, it is always inside of this box of 5-year survivorship, and you need to think long and hard about that. We're going to get into this more. So, throat cancer, esophageal cancer, bad news. You know, 97% or 96% of people are dead after 5 years with conventional treatment for throat cancer. Is that good? Those good results? I don't think so. The beat keeps on going. Kidney cancer, not very good. 89% or 90% of kidney cancer patients are dead after 5 years. Dead. There's no coming back from dead. You're dead. You died from cancer. For goodness sakes. We all need to snap out of it. Non-small cell lung cancer, well, 94% or 96% dead. Ovarian cancer, 68 or 73% dead after 5 years. Dead. Pancreatic cancer, forget it. My best friend in the world died from pancreatic cancer 10 years ago. 98% dead after 5 years. Adios, amigo. Dead. Stomach cancer. 96% dead after 5 years. We seeing a pattern here? Breast cancer survival rate. 67% dead or 77% dead, depending on whether you go to cancer treatment centers or you do conventional medicine at another hospital somewhere in the United States. Dead, 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 dead. This after $1 trillion or more of research money. Now, I need you to think about this. Look, if you have a broken leg, if you have a bullet in your arm, if you're a member of the military and you get your leg blown off, heaven forbid, by a landmine somewhere, then go to the conventionally trained MD because that's their wheelhouse. That's what they're good at. They will save your life. And the stuff they can do with emergency medicine and trauma care is just this side of miraculous. It's awesome. Thank God for Novocaine. Thank God for the sterile treatment. There's a place for conventional medicine, right? But when it comes to cancer, their results are horrible. But because they exist in the monopoly and because we have been socialized to believe that if they can't figure it out, nobody can, then we have all gotten used to this 5-year survivorship nonsense. Can't cure it. Can't cure it. You're going to die from it, most probably. Small set of childhood leukemias you're going to live from with conventional treatment, but that's it. Again, we all just need to snap out of it. And, you know, inside of a monopoly, you can do whatever you want to do, even though you're horrible at it. Because it's a monopoly. Now, breast cancer is a very interesting thing, right? So, here's one set of data. 77 or 67% of women die from breast cancer after they've had it for 5 years. But then, there's this other data. And I'm going to get rid of my image here, my lovely image here for just a second. Now, if you do a Google search for cancer survivorship, you'll come up with this startling statistic. Nearly 90% of women are alive, or so the statistics say, would lead you to believe, after they've been diagnosed with breast cancer. That's a really great rate, 90%. But remember, number one, it's a 5-year survivorship, and number two, there seems to be an inconsistency with the data here, because didn't we just see another chart that said that, 67 or 70% are dead? So how can these two things be equal? Well, number one, different types of breast cancer, but more importantly, these statistics with it showing a 90% survival rate after 5 years are based on a relative survival rate. A relative survival rate. Now, most people don't, most people in the U.S. aren't any smarter than a 5th grader, right? So they have no idea what this means. Relative survival statistics. Well, what is that? Most people would miss this. They'd miss it. And they'd think, oh, 90% cancer survival rate. Well, a relative survival rate groups people who have had breast cancer with everybody else in the population, and they chart at what age everybody dies in the population, and then they superimpose that with at what age people died from breast cancer. You get it? So they have tweaked the data in their favor. Well, so this does not mean that if you have breast cancer, 90% of women who get breast cancer are going to live after 5 years. It does not mean that. It means that relative to everybody else in the population, depending on what age they were going to die anyway. Well, now the data is confounded. What you need to look for is something called absolute survival rates, which means this is how many people got cancer, and this is how many people died from that cancer. Good luck finding that data. Good luck. I've looked for hours. It is nearly impossible to find absolute survival rates. And so, you look at the data and you're confused. You're misled. Now, is that you being misled on purpose, or is it just because the medical doctors have a very peculiar way of looking at things? I think it's a little bit of both. And, we can't overlook this. The money factor. The money factor is a big deal here. Cancer drugs hit an ever-increasing high prices, right? 1975, the average cost of cancer treatment, $129. Now in 2014, it's $9,905. Are you kidding me? I mean, this is kind of a big deal, right? Let's compare this to the survivorship. So from 1975, the average cost of cancer treatment was $129. And then in 2014, right, it went up to $9,905. That's like an 8,000% increase. That's an 8,000% increase. Meanwhile, for that exorbitantly extra amount of money that we've spent with breast cancer, we have achieved a 16% increase in survivorship. Lung cancer, a 7% increase. Prostate cancer, a 31% increase. Colon cancer, a 16% increase. Bladder cancer, a 7% increase. And we've spent 8,000% more money. Now, does that seem like a good expenditure of money to you? Well, it does not seem like a good expenditure of money to me. And yet, here we are, inside of the medical monopoly. You've got cancer, you're scared, you don't really know what to do, and why would you? Because that's not your wheelhouse. You trust that the medical professionals that you go to know what's best for you. But remember, your medical doctor may be the nicest person that God ever created, but your medical doctor doesn't know what's best for you. They only know what they've been trained in. And as it turns out, they've what they've been trained in is just one small piece of the pie of medical science. Really good for infections, well, some infections. Really good for trauma care, really good for emergency medicine, but really poor for cancer. And yet, the way that people talk about it, you would think, oh, we're closer to a cure for cancer now than we ever have been. And we're not. We simply are not. So, if you are unfortunate enough to have been diagnosed with cancer, there are some questions that you need to ask your medical doctor, and here they are. Number one, doctor, what's the cause of my cancer? What caused my cancer? I want to know. Do you know? By the way, here's how I would preface these questions. And I would ask these questions with a recording device and a witness. If you're a woman, a man, like a big man dressed in a black suit, who just stands behind you silently with his arms crossed. You just need information. Most people, they go to their medical doctor's office and they're intimidated. And that's kind of on purpose, that it's set up for you that way. You feel intellectually inferior in the presence of the all-seeing medical doctor, and you're surrounded by millions of dollars of technology and, you know, hundreds of, if not thousands of employees. And you think to yourself unconsciously, well, these people got it going on. They must know what they're doing. But in point of fact, they don't. Not when it comes to cancer. So here's how you should preface these questions with a recording device and a witness. Doctor, I've just been diagnosed with cancer. And as you know, medicine is a business here in the United States. Medicine is a business here in Canada, and I'm all for making money. Love making money. I think it's a great thing. And because it's a business, I'm shopping for my best treatment options. I'm shopping here. You can understand that, right? I mean, you do the same thing. So I have a number of questions that I would like you to answer concerning this diagnosis. And your answers will help me to determine whether or not to go with your treatment or somebody else's. I'm just here on an information gathering expedition, okay? I appreciate your time very much. All right, here we go. Number one, what caused my cancer? Now, you need to hold the medical professional's feet to the fire. The honest answer is we don't know. But often what you will get is the new false flag flown by conventional medical doctors. Oh, it's genetic. Now, saying that your cancer was caused by genes is like saying that tornadoes are caused by sunlight. Well, you can't have a tornado without a cloud, and you can't have a cloud without sun, so whatever. Saying that your illness, whatever it is, whether it's cancer or anything else, is genetic is kind of a dodge. But if they float that balloon, here's your next question. It's genetic? All right, thank you very much. Which gene is it? And on which chromosome is it found? You just told me it's genetic. Which gene is it? And on which chromosome is it found? And is the gene that's at play here a healthy gene or a mutated gene? By the way, the BRCA gene, the BRCA gene, right, that is related to breast cancer, is not a gene. It's a mutation of a gene. You know what the BRCA gene does in an unmutated healthy state? It fixes gene mutations. Well, that's a lecture for another time. So is it a healthy or a mutated gene? Oh, it's a mutated gene. It's always a mutated gene that's related to cancer. Always. What caused the mutation? What's that? You don't know what caused the mutation? Well, wouldn't that be an interesting thing to research? Wouldn't that be something to look to see what's going on? Why haven't you done that? Okay? Okay. Now, last question about the gene thing. So, you're telling me my cancer is caused by genes, and why has it taken so long to express itself? I mean, I've had this gene my whole life, right? I mean, haven't I? Wasn't I born with it? Or was I not born with it? Did it mutate down the road? And when did it mutate? And what's going on here? Of course, the answer to all of these questions will be not that good, not that satisfying, okay? Because nobody knows. Now, holistic doctors have an understanding that gene mutations are caused by nutrient deficiencies and environmental toxicity. That's our take on this, and again, that's a lecture for another time. But nonetheless, you're here on a fact-finding mission to ascertain the intellectual acumen of your oncologist. You want to know how good on their game they are, right? Because you're shopping. Question number 2. All right, we know what kind of cancer I have. You haven't really satisfied me with what's causing it. Can you cure it? Can you cure my cancer? Now, the answer to this question will be no. So then you follow that with, if you can't cure it, then what can I expect? And by the way, there is a difference between living for 5 years and then dying from cancer and curing your cancer. Okay? So if the conventionally trained oncologist or medical doctor starts talking about 5-year survivorship, just understand what that means. Okay? So remember it, honest questions. I mean, you'd ask similar questions if most people ask more questions about their automobile that they're going to purchase than they do about their cancer treatment, which is mind-blowing to me. Again, because we're intimidated by the medical doctor, and you think that if they can't figure it out, then nobody can, and they must know what's best for you, and so let's just sign up for treatment, whatever. Lack of knowledge destroys people. So, okay, so you can't cure it. What can I expect? Maybe I'll live for 5 years? Great. Okay, what kind of side effects are your treatments going to give me? What kind of side effects? Are the treatments that aren't going to cure my cancer, what kind of side effects are those going to give me? And how are you going to treat those side effects? I need to know. Is my hair going to fall out? Are my teeth going to fall out? Am I going to go blind? Or am I going to, what's going to happen to me? For goodness sakes. And by the way, can the treatments that you're recommending I take that are not going to cure my cancer, can they cause cancer? What's the likelihood? What percentages? What can I expect? I need to know. Please, just tell me. Okay, so if there's a likelihood that your treatment is actually going to cause a different type of cancer, how are you going to treat that? I need to know. Please. Look, this has all been very confusing to me, doctor. I don't know really what's going on here. You don't know what causes the cancer. Maybe it's genetic. You don't know what caused the mutation. Your treatments are not going to be curative. Maybe I'll live for 5 years. Maybe the quality of my life's going to be in the gutter. I mean, I'm confused. I very much need to know firsthand from 10 of your patients, my age, more or less, with my diagnosis, more or less. I need their contact info so I can call them up and say, hey, what happened to you with your treatment and how do you feel and do you think I should do it? I need to know that. And, the doctor probably then is going to say, no, we can't do that because there are laws that protect the patient's rights. But the patient can sign a waiver that says, yeah, you can let anybody who wants to talk to me. I'd have no problem with that. I mean, would you? If you had cancer and you went for treatment and then someone else who had your diagnosis wanted to talk to you about your experience, wouldn't you want to do that? You would want to do that. I wonder why the medical professional will hesitate at having you be able to do that. I mean, that speaks volumes, doesn't it? Okay, now the last couple questions, I've had patients kicked out of their doctor's office. The doctor just got up and left, which again is telling. And remember, we're asking these questions politely by way of information gathering. We're not being, I'm passionate about this stuff and I tend to be, you know. But you don't have to be all fired up like I am. Just ask polite questions. Remember, it's a business. You're shopping for the best treatment for you, most cost effective. Which then begs the question, well, how much money will you make from this treatment that's not going to cure my cancer? How much money are you going to make from this treatment? I need to know. Remember, I'm shopping. It's a business. Okay? How much? More or less. How much money is the hospital going to take? What are they going to profit from the treatment that's not going to cure my cancer? I'd like to know because I'm shopping. It's a business. Maybe I can get a better rate. I shop for credit card rates all the time. I shop for mortgages all the time. I just need to know. Thank you. And lastly, you don't really need to ask this question, but I put this question in just to try to level the playing field. Okay? All right, so you've answered all my questions about cancer, and I appreciate that. I got one more question. I really just need to know this just for my own edification to kind of give me a sense of you as a physician. Okay? I'd like you to give me a list of 5 common medical conditions not related to infection that you're able to cure. Just list them. Can you cure heartburn? What's that? You can't cure it? You can manage it? Okay. Can you cure high blood pressure? What's that? You can't cure it? You can manage it? Okay. Can you cure arthritis? No. Can you cure type 2 diabetes? How about insomnia? How about anxiety? How about depression? How about fibromyalgia? How about osteoporosis, osteopenia? Anything? Now look, it's your life. You get to make your own choices. But my point here is don't be bullied into treatment that's not going to be effective downstream. Now, medical advancements happen all of the time, and maybe they'll develop something that really does have a remarkable cure for cancer, and that's just going to be awesome. But so far, it hasn't happened. It hasn't even come close to happening. And here we are, right? Left on our own. So, now, this begs the question, well, what about alternative medicine? By the way, I hate that term. I hate alternative medicine. It's not alternative. That's like, using the term alternative medicine is like saying the only real dog is a German Shepherd and every other dog is an alternative dog. It's nonsense, right? It's holistic medicine, naturopathic medicine, right? Call it for what it is. So in holistic medical circles, all that we have are anecdotal treatments and outcomes by a handful of brave holistic physicians around the world who have abandoned conventional medicine because for cancer, conventional medicine does not work. It just doesn't work. You just drill down the data, have some understanding of relative versus absolute survival, wrap your head around the 5-year survivorship paradigm and just start asking some questions. It's your life. By the way, we didn't even get into how much cancer costs, cancer treatment costs, and what the escalations of that are going to be over time. It's remarkable. Let me see if I can pull those slides up right now. Remember, this is a live presentation, right? So bear with me here. Hold on. Okay, so here we go. Sorry for the delay. Now, this data from the National Institute of Health, by the way, the projected number of U.S. cancer cases for 2000 through 2050 based on current projections, right? Does that look good to you? Is cancer getting less and less, or is it getting more and more? It's getting more and more. It's not getting less and less. And this is because conventionally trained medical doctors don't know what causes cancer. And the tumor is not the disease. The tumor is the result of the disease. So when all of your treatments are focused on eliminating the tumor, right, surgically removing the tumor, burning the tumor out with radiation, or dissolving it with chemotherapy, that treatment doesn't eliminate the cause of the cancer, doesn't eliminate the cause of the tumor. So guess what? The tumor comes back, and that's why people die. Because when it comes back with a vengeance. But this speaks to the simple fact of the matter that we expect cancer rates to increase. For goodness sakes. Because conventionally trained medical doctors are clueless. Oh, it's genetic. Yeah, I don't think so. National expenditures for cancer care projected to increase by 27% by 2020. By 27%. It's big business, man. Cancer is big business, baby. And again, there's nothing wrong with making money, but for goodness sakes. I guess we're all okay with the whole 5-year survivorship thing. That's about how long an automobile lasts. Well, your automobile can last 20 years if you take care of it, longer. But, people tend to get rid of their cars after, 5, 6 years. So I guess we've all been kind of socialized to believe in this nonsense. Facts are a stubborn thing, folks. And so, look, just empower yourself. Ask questions and become a subscriber to my self-help health recovery information on my website. Visit my YouTube channel, this channel. Visit my Facebook channel. I've got tons of free information. We're not here to cast aspersions. We're just here to tell it like it is. For goodness sakes. The medical doctors, the people who can't cure disease, have been telling you and everybody in your family that I'm a quack and that all my colleagues are quacks and that we're the ones practicing back of the bus, dangerous, ineffective medicine. Well, quite frankly, just the opposite is true. While the medical doctors have been in complete and utter control over the development and the delivery of medicine for 100 years, how's that working for you? Autism, through the roof. Obesity, through the roof. It's the new norm, right? Now we've got TV shows with morbidly obese people as the lead roles, and it's supposed to be because it's not their fault. It's just life. Well, no, it's not life. It's life under the care of the MD. And the MD is awesome. If you're in a car accident, heaven forbid, snap your leg in 5 different places. Pretty good at that. But not for anything else. It's time we all woke up collectively. We need to have a free medical market. There need to be naturopathic medical schools in every state. There need to be naturopathic hospitals in every state. There needs to be naturopathic research money given. And until these things happen, not in our lifetimes, we need to hold each other up. Empower each other to understand what's going on and to just step up to the bar and ask honest questions. I am your steadfast advocate for health, Dr. Peter Glidden. Thanks for your time. I look forward to seeing you in the future. Until then, live long and prosper.